Welcome to UWorld's Next Gen NCLEX Review. So great to see you all back today. My name is Samantha. I am a nurse here at UWorld, and today we are covering infection question drill. So we're going to be covering infection questions, infection prevention, precautions, things like that. You may already be familiar with this. Per usual, it's going to be the question drill format. I'll read the question, give you about 30 seconds to drop your answers into the chat, dig deep in your brains, and then we'll talk through why the correct answer was correct, why our incorrect options were incorrect. So reminder, share this session, give us a follow if you haven't already so you don't miss any of our content in the future, and make sure that you are chatting in the chat. We have the wonderful Nursing Coley moderating today, so any questions, comments, or of course answers to today's questions, make sure you pop those into the chat so we can hear from you. All right, so starting out with question 1, here the nurses in the emergency department has collected information about clients waiting to be seen. The nurse should first assess the client who has, is it epistaxis and takes aspirin, dysuria and takes tamsulosin, 3, vomiting and reports frequent loose stools, or 4, a persistent cough and reports night sweats. Drop those answers in the chat. Let us know what you're thinking. And another reminder, any topics that you guys want to see us present on, go ahead and drop those into the chat too. Maybe it's cardiac, maybe it's respiratory. I know there are a lot of things that we get consistent requests for. Everyone always wants more pediatric and maternal OB content, so we're always trying to work more of that in. All righty. Hello there, Rachana. It is nice to see you here. I'll give you a few more seconds to keep answering. Again, we're doing an infection question drill today. Alrighty, so keep those answers coming. I do see kind of a split in the answers that we see coming in. 1s, 3s, and 4s, so we're a little bit all over the board, but that is no problem. We will go over this in depth when I reveal the answer. But a couple of different answers, and I love it when people put in the rationales, so thank you for doing that too. It's always interesting to see where everyone's train of thought is going. But it looks like the majority of people still managed to get the question correct, and I was looking for option number 4. So why was this? When we look at all of these options, 1, 2, and 3, no one really even seems life-threatening in this moment, but what we see in option 4 is hinting towards tuberculosis, commonly called TB. So we know TB is highly contagious. It's spread through those airborne droplets, so we need to make sure we isolate this client, perform that testing, make sure we're following appropriate protocol. So for airborne, we're going to want to have that N95 mask. So this would be our first priority because we want to stop the spread and contain this client. Options 1, 2, and 3, again, not life-threatening. 1, takes aspirin, makes us more likely to bleed. It's a bleeding risk, and they're having an epistaxis is just a nosebleed. Again, this is not going to be ultimately compromising people's safety. Option 2, dysuria and takes tamsulosin. Tamsulosin is a medication commonly given for BPH, or benign prostate hyperplasia. We know painful urination can happen along with that. So this is really just more going along the lines of that BPH. They may have a UTI. We can try and rule that out, but again, not our top priority. And lastly, the vomiting and the loose stools sounds a lot like some kind of gastritis, maybe a food poisoning, but again, not our first priority over TB. Great job, you guys. Let's move to question number 2. So the nurse is preparing to administer vaccines to assigned clients with HIV infection. Which of the following vaccines should the nurse hold for clarification prior to administering? So is it the pneumococcal conjugate vaccine? Is it that HPV virus, or vaccine, excuse me, hepatitis A vaccine, or the varicella vaccine? Alrighty, keep letting us know what you all are thinking. And I saw some great recommendations for other topics that you all want to see. We will do our best to work those into our content calendar. Thank you so much for participating. We got some asks for oncology. I believe we have oncology coming up soon, so we will definitely cover that. It's a great recommendation. Alrighty, and it looks like we're doing a lot better on this question than we did on the last one. We're getting the hang of it. I think we just had to get into the groove today. But you guys are totally right. It is that option number 4. So why was this? In this case, we're talking about a client that has an HIV infection. We know this virus works to destroy those CD4 cells, which are an essential part of the immune system. We never want to give an immune compromised client a live vaccine, and that varicella vaccine is a live vaccine. vaccine. So we would not want to give this to the HIV client with that compromised immune system. So option 4, we would want to clarify, call that provider up and say, what were you thinking when you ordered this? But 1, 2, and 3 would not be the same. So again, option number 4. Alrighty, question 3. So the nurse is caring for a client with Hep C. Which of the following actions should the nurse take? Select all that apply. So our options are: instruct the housekeeping staff to use bleach products to clean surfaces in the client's room. 2, monitor the client's laboratory test results for a prolonged PT and activated PTT. 3 is instruct the client to use condoms when engaging in sexual intercourse. 4 is request a prescription for lactulose for the client. Or 5, monitor the client for jaundice. This is our first SADA question, or select all that apply of the day. Our biggest tip for SADA is to treat each answer option as an individual. We're not comparing and contrasting. We're not saying, hey, if this one's right, that one has to be wrong. Treat each one like a true or false question, and that's going to be the best way to tackle these SADA questions. We're always expecting between 2 to 4 correct options. Only 1 correct or all 5 correct are very rare. Alrighty, lots of great answers coming in. And if you guys haven't yet, make sure you check us out at uworldnursing.com. This is our home base for all of our nursing social efforts. It has a complete calendar of all of our lives. We now go live between 5 days a week, 7 times a week. So lots of those, too many for me to state out here. Check out uworldnursing.com for the full list of times, channels, and topics that we plan to go live, so you never miss a topic that you want to see more about. We also have links to our products, links to our free trial, as well as prevalent blog posts. So again, uworldnursing.com. I can't say enough about it. Make sure you check it out. All right, let me check our answers. And I see, again, we're kind of all over the board. It looks like 3s and 5s was where we landed, but I see 1s, 4s, and 2s involved. So let's walk through this one together. Correct option: 2, 3, and 5. So Hep C is a bloodborne pathogen that infects the liver. This has a lot to do with the liver when you see hepatitis. So common causes include needle sharing. So things like a needle stick injury for a healthcare worker from an infected client. It can be things like encounters with contaminated blood, maybe tattoo equipment, maybe IV drug needle use, things like that. So since the virus infects the liver, we're gonna worry about liver function. We need to make sure we monitor that when we're taking care of these clients. We also want to monitor things like PT and PTT, which indicate clotting time and are an indicator of liver function, how well those liver is doing. We want to make sure that our client is not at risk for bleeding, which is a big reason that we monitor that PT and activated PTT. We also want to make sure we teach about using protection with these clients, especially if they're engaging in risky sexual behaviors. And jaundice is another way. It's an indicator of liver failure. So that's why we would definitely want to monitor the client for jaundice. It would be a sign of disease progression. So checking the sclera of the eyes and kind of the face for that yellowish discoloration. Option 1 and 4 were incorrect. So why was this? Instruct housekeeping to use bleach products. We don't need to do this for Hep C. Bleach may be used for things like C. diff with these contact precautions, but we're not going to have to use this with Hep C. Option 4, prescription for lactulose for the client. That is for the buildup of ammonia and does not treat Hep C, but more so the complications of cirrhosis, which we're not quite to that point at this point. We don't have an indication that this client has progressed to cirrhosis. So again, 2, 3, and 5 were our correct options. Great job, you guys. All right, halfway there. So the nurse is screening clients for those at risk for developing influenza. Which of the following should the nurse recognize is a risk factor for influenza? And again, another SADA question. So is our risk factors, is it consuming a plant-based diet, a history of type 2 diabetes mellitus, resides in a long-term care facility, receives hemodialysis 3 times per week, or 5, takes methotrexate for rheumatoid arthritis? Drop those answers in the chat. Let us know what you think the risk factors for influenza are. And another reminder, we have another great resource at uworldnursing.com, and that is our question of the week resource. So if you're on our social channels right now watching this live, you're probably already pretty familiar with our question of the day that we put out every single day. But question of the week is another great free resource that we are putting out for you guys. Simply go to uworldnursing.com, select the question of the week link, and you can enter your inbox to get a different question every single week straight to your inbox. So we're trying to make sure we're giving you guys lots of resources to really get you in tip-top shape for that NCLEX. And as UWorld, we want to make sure that we give you guys some free resources, because we know that time in between school before you take your NCLEX and get that RN and start your job can be times we really need to be cost conscious. So lots of free resources. Make sure you're taking advantage of them, again, at uworldnursing.com. I bet you're probably sick of me saying that. All right, lots of great answers. And this one, again, I see you guys did very, very well. Way to go. So what I was looking for here was 2, 3, 4, and 5, everything but 1. So when we're talking about the flu, we know there are certain risk factors that make certain individuals more likely to contract it. So having a suppressed immune system from either a condition like a diabetes or those on dialysis, or suppressed immune system can happen from certain medications like methotrexate, which is an anti-neoplastic medication, as well as any place where we're around a lot of other people, exposed to a lot of other germs and pathogens, things like a long-term care facility, things like a school or a daycare facility as well. So 2, 3, 4, and 5 were correct. 1 was incorrect. Consumes a plant-based diet has no bearing on risk factor for flu. Eat all the fruits and veggies that you want. Alrighty, great job, you guys. Question 5. The nurse in the urgent care clinic has sought a client with newly diagnosed streptococcal pharyngitis. Which of the following statements by the client would indicate a correct understanding of the teaching? Select all that apply. Our options are: I plan to place a humidifier in the bedroom. 2, I should contact the clinic if my urine color changes. 3, I will receive a prescription for an antiviral medication. 4, drinking cool citrus juices will be soothing to my throat. Or 5, gurgling with warm saltwater mixture may alleviate my pain. Drop those answers in the chat. Let us know what you guys are thinking. In the meantime, also keep letting us know how you all like to study. We're so interested to see all the different ways that there are available now to study for the NCLEX. Do you prefer flashcards, a workbook, maybe a 1, 2, 3 day live review in person or virtually? Are you guys on a certain question bank? Let us know how you guys are studying for the NCLEX. I was a question girl. That's what I like to do, was just targeting questions for whatever topics I wanted to improve on that day. But I'm always interested to see. I know there's a lot of stuff out there. I use random questions as one answer. I don't know where random question comes from, but that is interesting. And nurse lecture, great answer. Someone also listened to lectures on the Stairmaster. I wish I had taken that approach. All right, and lots of great answers coming in too. I see Petros used the lectures in the UWorld QBank, so we love to hear that. Thank you, Petros. Okie doke, so I think we have enough answers in now. I'm going to go ahead and jump to our correct options, which are 1, 2, and 5. So we're talking about strep throat here, which is a bacterial infection of our throat. So that should already be a hint as to why option 3 is incorrect. So it's going to be treated with medications, antibiotics for a bacterial infection, like an amoxicillin is a really common one here. We can encourage certain comfort measures like gargling with warm salt water to help kind of soothe that pain and inflammation. Humidified air can also increase client comforts. We want to make sure we're indicating what are certain complications that are going to be a cause for concern of post-streptococcal glomerulonephritis. So essentially that strep bacteria goes all the way down and infects the kidneys. One big thing is what happens when this strep infection invades the kidneys, and we can see changes to our urine color. It can be like cola colored urine. So we should definitely make sure we're placing that humidifier. That's a comfort measure. We're making sure we're telling the provider if that urine color changes, that Coca-Cola kind of brown dark colored urine is going to signify that post-streptococcal glomerulonephritis. And we want to gargle with warm salt water. Again, that's just another comfort measure. 3 and 4 were incorrect. So why is that? Again, pharyngitis, when we see that itis, that's an infection of a bacterial source. We're going to give an antibiotic. We would want to give an antiviral for a viral infection. Cool citrus juices, the cool is great. That would be very soothing, but citrus is acidic. That's going to irritate the already red, inflamed throat. So we don't want to do that. Option 1, 2, and 5, again, were our correct options. Great job, you guys. All right, question 6. So here the nurse is reviewing client care assignments for the next shift. The charge nurse should intervene if a nurse who is pregnant is assigned to care for a client with option 1 is cytomegalovirus or CMV infection who is receiving ganciclovir. 2 is sepsis who is receiving IV vancomycin. 3 is myasthenia gravis, who is receiving IV immune globulin. And 4 is cirrhosis, who is receiving lactulose therapy. Drop those answers in the chat. Let us know what you're thinking. Again, we have reviewing pregnant nurses' assignments. So what can and what cannot a pregnant nurse do? I already see a couple people in the chat dropping their answers in, and someone already named torch infections as an explanation. So way to go, you are a step ahead. All right, we are live now so many times a week. We'll be back again tonight with Nurse Andrew at 7 p.m. Central. We're going to come back again tomorrow at 11 and 3 p.m. Central Time with Nurse Incoli. And then we're back with Nurse Andrew at 7 p.m. on Friday for any of our people that prefer those evening times. I know sometimes evenings and weekends are a little bit easier, especially for all of you guys that are so busy with work and school during the week. We've also added that 7 p.m. on Sunday. We're also debuting some new content in these question drills on the Sunday lives too, so make sure you stay tuned for those. I believe this Sunday is emergency and triage, which is a new one, so make sure you put a reminder on your calendar for that one. Alrighty. Someone on Instagram said they're glad they used the UWorld subscription to knock out the NCLEX. Well, we are too. Alrighty, so I'm going to go ahead and jump to our answer. Almost all of you got this right, but I was looking for option number 1. So pregnant nurses need to take certain precautions and follow certain guidelines to prevent the transmission of specific pathogens that can be harmful during pregnancy. So CMV is one of the torch infections, TORCH. This stands for toxoplasmosis, other, which is kind of a cheat code to do it, which include parvovirus B19 and the varicella zoster virus. Rubella is the R, CMV or cytomegalovirus is the C, and herpes simplex virus or HSV is the H. So CMV specifically is harmful to the fetus because it can cause deafness. Other things pregnant nurses need to make sure they're avoiding are certain medications like that ganciclovir or chemotherapeutic agents, as well as radiation. These can all cause serious fetal abnormalities, but again, CMV was our correct option because it's a part of those torch viruses. Alrighty, great job on that one, you guys. Someone asked how long this live is. They're usually about 30 minutes, give or take a few. All right, so question 7. The nurse is caring for a client with varicella who has open lesions. Which of the following infection control precautions should the nurse implement? Should they wipe down all surfaces with bleach before exiting the client's room? Should they place the client in a semi-private room with a client who has pertussis? Should they limit the client's family members to one 30-minute visit per shift? Or put on an N95 respirator mask, protective gown, and clean gloves before entering the client's room? Again, this one just boils down to those infection control precautions. I think those are something you learn right off the bat at nursing school, and the easier or the quicker you can commit them to memory, the easier of a time you're going to be answering these fundamental infection questions. Alrighty. Also, let us know who here is scheduled to take their NCLEX. Let us know when you plan to test so we can wish you good luck. And let us know who here has already passed their NCLEX so we can congratulate you. It's always so interesting to see where everyone is in their NCLEX process, their NCLEX journey. And for some of us, it definitely is a journey. So I see a couple in August the 28th. I see a September 19th. It's one of my best friend's birthdays, so that is a good luck charm for sure. August 19th, August 20th, and someone takes it tomorrow. Good luck. You guys are going to do great. That's exciting. But we have lots of passers. And Violet Yu on TikTok already passed, but she still loves to do practice questions. Well, we're happy that you do. We're happy to have you here. And I see a lot more September ones too. We always count June and July as our biggest testing months, but there are still some August and September testers. Thanks for tuning in. I hope we see you again. All right, so lots of answers came in, and I think the majority of you got what this question was asking. Option 4 is going to be our correct option. So varicella is the virus that causes the chickenpox. No shocker there. When caring for a client with chickenpox who have open lesions, as the question states, the nurse needs to follow certain airborne precautions, i.e. that N95 respirator mask, as well as the contact precautions like a disposable gown, gloves, and equipment that's disposable like a stethoscope that you can leave in the room and dispose after the client gets discharged. So in this case, we're doing airborne because of it, the varicella, but because we have open lesions, we also have to enact those, contact precautions. Alrighty, 1, 2, and 3 were incorrect. So why was this? The bleach, this is going to be enteric contact, so like C. diff is what this is for. Option 2, semi-private room, this client needs their own private room. And lastly, 3, limit visits by the client's family members. We would not typically do this. They would be entering at their own risk to be with the client, but we would need to educate the clients on precautions that they would need to take to protect themselves as well as prevent the spread by taking it and spreading it to their own loved ones, their families, or their coworkers. All right, so again, option 4 was the correct option. Way to go, you guys. Last question. The nurse has attended a staff education program about the prevention of CLABSI, which is central line associated bloodstream infections, quite a mouthful, in clients who have CVADs or those central venous access devices. It would indicate a correct understanding of the program if the nurse, 1, assesses the CVAD insertion site and dressing once every 24 hours, 2, disconnects the IV tubing from the CVAD when changing the client's gown, 3, changes the transparent CVAD dressing every 5 to 7 days or when the dressing is soiled, or 4, scrubs the CVAD insertion site in a circular motion using an alcohol swab while changing the dressing. That's a lot of addendums, a lot of things going on in option 4. All right, so let us know what indicates a correct understanding of the teaching. Also, after I reveal the answer, make sure you let us know how many questions out of 8 you got correct. Did anyone get 5 of 8, 6 of 8, 7 of 8? Do we have any perfect scores? We're always interested to hear, but again, we're all here to learn, so absolutely no worries, no pressure. We'll get there together. All right, lots of answers coming in. I don't quite see a consensus yet. It looks like we're kind of all over the board. This one is a little bit tricky, but I see 1s, 3s, and 4s. All righty, let us know. Again, correct understanding of the program, meaning we're looking for an indicated safe action. Alrighty, so our correct option was option number 3. So let's walk through this. Why was this? Central line dressing changes are going to be sterile procedures. They must be are performed correctly to prevent the likelihood of infection like CLABSIs. CLABSIs can lead to sepsis. This is why there's such a big deal. Often many hospitals now have protocols for this to try and reduce the risk of CLABSIs. Option 3 is the only appropriate option here. That's why it's our correct option. In option 1, assessing this site once every 24 hours, you need to do this every time you access it as well as at least once per shift. Every 24 hours means it would be every other shift. That's not frequent enough. Option 2 is disconnects the tubing from the CVAD when changing the client's gown. We only disconnect when we're changing the dressing or if we have to replace the tubing. And lastly, 4 talks about doing all of these things with the alcohol swab. Big thing here, we're using chlorhexidine. We're not using a simple alcohol swab. We have to be pretty strong and hefty to make sure we're fighting these CLABSIs. So we're not using alcohol, we're using that chlorhexidine. Again, option 3 was our correct option and the only indicated action. So great job, you guys. Way to go. Thank you for joining. Make sure you come back tonight at 7 p.m. and we'll see you again tomorrow at 11 and 3. Hope you guys have a great day.